And I believe Shayla just joined. Shayla Holmes.
Present.
Thank you. And that does give us quorum.
Awesome. Thank you so much, Shannon. And that brings us to item number 2, public comment. Does anybody have any public comment? Hearing none and seeing no hands raised, we'll move on to item number 3 for possible action, approval of the April 22nd, 2025 meeting minutes. Can I get a motion?
Hi, this is Ellen. I move to approve.
Awesome. Thank you, Ellen. A second?
This is Ann. I second.
Thank you. All those in favor signify by saying aye.
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 Any opposed? Any abstentions? Awesome. The minutes for April 22nd pass. Item number 4 for possible action. The Grants Management Unit Fund for a Healthy Nevada Notice of Funding Opportunity for Independent Living Funding Recommendations. Tawny?
They are attempting to get on as we speak.
Oh,
I think they're having a little difficulty.
Okay. Is Michelle on? Should we move forward to her to?
We can do that. Sure. I'm here.
Oh, perfect. Then we will come back to item number 4. We'll go to item number 8, and that is GMU Fund for Healthy Nevada, NOFO for Family Resource Centers funding recommendation. Oh, I lied. Number 7, erase all that. Federally Qualified Health Center.
Okay, got it.
Sorry about that, Michelle.
No worries. Okay. Let me share here, make sure. Okay, and we'll start. Okay, thank you all for being here today. Let me pull up my other screen here. There we go. We're going to go over the Fund for Healthy Nevada Notice of Funding Opportunity for the Federally Qualified Health Centers and the GMU funding recommendations for the applications we received. And I'm Michelle McNeely, the Social Services Specialist 3, and I manage the program funding. The agenda will go over the purpose of the funding, the overview of eligibility, the available funding for state fiscal year 26 and 27, the applicant review, and the Grants Management Unit funding recommendations, and then come to a conclusion and open it up for committee questions at that time. Okay, the purpose of funding. This funding serves as a one-time source to enhance services for pregnant and postpartum mothers and their infants in a medically underserved area. The intent of this funding is to provide seed money for sustainability and foster interagency collaboration in the community. All projects must align with the objectives as outlined on page 4 of this Notice of Funding Opportunity, which is published on the website. It was a lot of wording, so we wanted to keep it concise. Okay. Eligibility criteria. Any existing federally qualified health center or a lookalike as defined by the Health Resources and Services Administration and certified community behavioral health centers as defined by the Substance Abuse and Mental Health Services Administration are eligible to apply for this funding. And then to go deeper in, federally qualified health centers or community-based organizations that provide comprehensive primary care and preventative care, including health, oral, mental, and behavioral health services to people of all ages, regardless of their ability to pay or health insurance status. And then we'll move on to these certified community behavioral health centers also serve any individual in need of care regardless of the ability to pay. They provide outpatient behavioral health services and primary care screenings and monitoring for children, adults, and families with the goals to provide community-based mental and substance use disorder services, combined behavioral health and physical health care with no wrong door entry to services, with evidence-based practices, improved access to high-quality care, care coordination, and case management to address all needs of the individual and better overall health outcomes. Okay. Now, the available funding for state fiscal years 26 and 27. The first section here goes over how this funding was allocated. It was in the 2017 Nevada legislative session. The Fund for Healthy Nevada, a portion of it was used to initiate projects under the Federally Qualified Health Center Incubator Project. Since then, we've had 2 years each of these incubator projects focusing on a different specialization. And this year is the pregnant and postpartum women and their infants. And then just a note here, tobacco settlement funds have decreased, resulting in reduced revenue from the Fund for Healthy Nevada. This caused a 12.77% reduction in funding in year 1 and a 12.52% reduction in year 2. And for this specific funding, we received 5 applications in total. And in the table here, I kind of outlined for each fiscal year, the NOFO estimated dollar amount, which is based on historical allocations for this funding. So that was $700,000. And then the approved funding amount after the reductions I just spoke about for each fiscal year, and we'll show you that total there. And then the total dollar amount requested by these 5 applicants, and then the total dollar amount we were able to award based on availability of funds. Okay. The applicant review. So we did receive 5 applications in total. 4 of the applicants were qualified. So we do have that here. We have the 4 applicants, the area that they are based in or service, and their project summary. First is Hope Christian Health Center, based in the Las Vegas Valley. They want to increase access to postpartum and mental health services through their clinic locations and through mobile outreach clinics. Northern Nevada Hopes, they're based in Northern Nevada. Medical and behavioral health, pregnancy and postpartum trainings for their staff to support integrative maternal care by expanding knowledge and capability of their service providers. And Quest Counseling, also based in Northern Nevada. They want to expand their perinatal mood and anxiety disorder services by hiring a family therapy intern, a social worker intern, and clinical professional counselor intern. And then finally, we have Nevada Health Centers, and they are statewide. They want to provide a comprehensive maternal behavioral health program to include treatment, case management, and in-person and telehealth follow-up options. Okay. And then here are our recommendations. Again, this is based on availability of funding, statewide coverage, and the ability to provide services as proposed. So Hope Christian Health Center outlined each here how much they requested and then how much we were able to fund, again, based on availability for year 1 and year 2. So state fiscal year 26 and 27. Okay. And then that concludes my presentation. Are there any questions from the committee at this time?
This is Elisa Berlin. I don't have a question, but I wanted to share that although I didn't take the lead on writing the grant for Quest Counseling, I do represent that organization, so I'll be recusing myself from that vote.
Okay, thank you. Okay, any questions?
Michelle, this is Stacy. On the Nevada Health Centers one, I see that they wrote for almost the full amount of available funding.
Yes.
And their funding is substantially less than that. Are they still going to fulfill what they're asking for with such a reduced amount?
So yeah, so basically these recommendations will include negotiations with the agency. This will basically be what they propose, but scaled down a little bit. Basically as a startup project rather than a full scale. So that again, based on availability of funding, that's what we were able to do. So we'll reach out to them and negotiate. That's just part of the process.
Perfect. Thank you.
You bet. Thank you. Anything else?
This is Kelly Quintero for the record. And Michelle, I just wanted to add to the committee too that you're going to find that the ask was much greater and sometimes 166% over the amount that was available. So we had to look at the availability of funding. We had to look at the service area and the ability for our subrecipients to be able to carry it out. We will go into the negotiation phases if we're saying we can fund you, but only half the amount that you asked for. And if they're able to do that, then they will. And if not, we'll go to the other individuals and perhaps fund them fully. So the negotiation period for these budgets is going to be difficult for sure.
Thank you, Kelly. Any other questions? Okay, then I'll hand it back to the chairperson. Thank you.
Thank you, Michelle. With no questions being asked, I will ask for a motion to approve the funding recommendation as presented by Michelle.
This is Ally, and I'll make a motion to approve the recommended funding.
Thank you. And then a second.
This is Fernando. I'll second.
Thank you. All those in favor signify by saying aye.
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 Any opposed? Any abstentions? I heard one earlier, so I don't know if you want to get it in record. Hearing none, the funding recommendations pass. And Shannon, was Tawny able to get on?
Hi, I'm here.
Perfect. We'll go back to item number 4 then, and for possible action, Fund for a Healthy Nevada Notice of Funding Opportunity for Independent Living Funding Recommendation.
Perfect. Thank you, Stacy. I will share my screen. My name is Tawny Chapman. I'm the the Grants Management Unit Program Manager, and I'll be overseeing these funds. So this was for Fund for a Healthy Nevada, Independent Living, Respite, and Positive Behavior Support. All right, here's the agenda. We'll just go over the background of the funding, eligibility, the available funding we have, each of the awards, and then we can go back to the chair. So for the background, the Nevada Department of Health and Human Services is responsible for administering the Fund for a Healthy Nevada to supplement existing funds. The FHN is a source of state revenue, which is funded through tobacco settlement monies received or recovered by the state of Nevada. The grant will serve as a one-time funding source. So for eligibility, it includes public and private nonprofit organizations located in Nevada. The grants unit must be assured that partners have adequate systems in place to properly administer the grant, both financially and programmatically. So this is going to be 2 years of funding, so state fiscal year 26 and 27. The dollar amount available for independent living is $479,774. Year 2 is $481,116. And you'll see in there the total amount requested was substantially higher than what we could actually award. So respite is $558,283 for year 1, and year 2 is $559,844. Again, the amount requested by each of the agencies is substantially more. And positive behavior support is 279,141, and year 2 is 279,922. We were almost able to break even on that one. So I'm sure Michelle had said in her presentation, the tobacco settlement funds have decreased, resulting in reduced revenue for the fund. So year 1, kind of just reiterating the amount we have, the amount requested. So the independent living services are to improve access to independent living and supports. These services are provided to all persons with disabilities so that they may have full access to community life. Core independent living services include information and referral, skills training, peer counseling, individual advocacy, and transportation. So we had quite a few applicants. So Lyon County Human Services is one. The funding opportunity would allow for the Adult Services Division to advocate for individuals with disabilities through person-centered planning and case management services. They would offer individualized support, including home visits, skill building, financial counseling, and the SSI, SSDI Outreach Access and Recovery, SOAR. The division's new initiative includes training adult services case managers as accredited financial counselors to provide specialized financial education to individuals with disabilities, improving financial literacy and long-term stability. The recommended funding amount is $110,000. Moving on, we have Nevada Rural Counties RSVP. This program is a service designed to provide seniors and adults with disabilities in rural Nevada with accessible paratransit, door-to-door transportation. This program ensures that individuals with mobility challenges have the means to attend appointments, grocery shops, social events, and fostering their ability to remain independent and engaged. The transportation will be provided through fleet vehicles and volunteers, offering flexibility and cost efficiency in service delivery. The recommended funding amount is $130,000. Next, we have St. Rose Dominican Dignity Health. St. Rose Dominican's Helping Hands of Henderson program provides safe, reliable transportation and social support for vulnerable seniors. The funding will provide approximately 5,000 one-way rides to food pantry, meal sites, grocery stores. It'll also help seniors address nutritional needs and maintain independence, dignity, and self-sufficiency. The recommended funding amount is $90,000. Helping Hands of Vegas Valley's next. Their transportation program provides critical no-cost transportation services for low-income and disabled seniors in Southern Nevada, ensuring access to medical appointments, grocery stores, pharmacies, social services, and community resources. We have this one as recommended $100,000. And Neighbor Network of Northern Nevada, also N4, will offer discounted Lyft vouchers each month to people with disability and older adults in Washoe County through the 2-year project period. Their transportation program coordinator will provide the hands-on training to participants to use the Lyft app, as well as teach participants how to access traditional transportation resources. They'll conduct community outreach activities to include quarterly technology workshops and presentations for people with disabilities and older adults in the community. The recommended funding amount is $49,000. So for that section for independent living, are there any questions? I can turn it over to the chair. Okay, hearing none.
Perfect. Hearing no questions, we'll move it to vote. Can I get a motion to approve the funding recommendation as presented by Tawny?
This is Ally. I'll motion to approve the recommended funding.
Thank you. And a second?
This is Ellen. I'll second.
All those in favor signify by saying aye.
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 Any opposed? Any abstentions?
This is Shayla Holmes. I'll be abstaining as the Director of Lyon County Human Services.
Thank you, Shayla. All right, motion passes. Moving on to item number 5, it's another funding recommendation for the Fund for Healthy Nevada, NOFO or respite. Tawny?
All right, Tawny Chapman here again. So year one, we have $558,283. The total amount requested almost 1.5 million, and year two is 559. 844 available with the amount requested almost 1.5 million. So the respite services are to improve access and coordination for respite services and support. These services promote person and or family-centered approach in care planning and caregiver support. All right, so Amplify Life is seeking funding to improve access and coordination for respite services and support through their respite program. Their services and support are provided through the valuable skills and recreation programs at their Skills and Recreation Center and various recreational life expanding camp programs for individuals with disabilities. The program also provides after school and weekend skilled courses, cooking, social and recreational classes, health and wellness, games, arts and crafts, community exploration, and gives the individuals with disabilities the opportunity to live, learn, and play as a vital part of the community. The recommended funding amount is $72,820. Moving on to Lyon County Human Services. The funding would supplement existing funding to the Senior Services Division Caregiver Support Program. The target population for this funding opportunity are Lyon County residents who provide caregiving services. The Caregiver Support Program uses powerful tools for caregivers curriculum. PTC was developed to reach caregivers of any kind. The Caregiver Support Program also includes the innovative LEQ devices to aid individuals and caregivers, as well as a pilot respite care service using temporary staff in-home and in senior centers. The recommended funding amount is $80,000. Helping Hands of Vegas Valley has a respite care voucher program that provides support to family caregivers of older adults with Alzheimer's, dementia, and related disorders in Southern Nevada. Helping Hands of Vegas Valley has helped caregivers balance demands of full-time caregiving with their own well-being by offering vouchers up to $1,000 for respite care services. The services include in-home health aides, adult daycare, and short-term assisted living stays, allowing older adults to remain in their homes while caregivers need a break to rest and manage personal responsibilities or avoiding burnout. The recommended funding amount is $177,764. $177,764. Moving on, Nevada Rural Counties, RSVP. They provide critical relief to caregivers and preventing unnecessary institutionalization of care recipients. The expansion of this program would help prevent caregiver burnout by offering respite services that reduce stress, anxiety, and physical exhaustion. It would also reduce hospitalizations and delay in nursing home placement by providing timely respite care that allows families to maintain home-based support. These funds will support caregiver support groups, training, outreach initiatives to improve awareness and accessibility of resources. The recommended funding amount is $113,849. Neighbor Network of Northern Nevada, their community care program will expand to provide respite care services and comprehensive case management to support 50 additional individuals, 25 primary caregivers, and 25 people with disabilities and older adults. N4 will provide in-home and community-focused respite care and case management services to primary caregivers. Each primary caregiver will receive at least 4 hours per week of respite care, in addition to at least 4 hours a month of comprehensive case management to include information and referral to other community resources. The recommended funding amount is $113,849. So, are there any questions or recommendations? If not, I can turn it over to the chair.
Thank you, Tony. Hearing no questions, I will ask for a motion on the respite funding recommendations.
This is Fernando. I'll make that motion.
Thank you. And then a second.
This is Ally, I second.
All those in favor say aye.
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 Any opposed? Any abstentions?
This is Shayla Holmes. I'll be abstaining.
Thank you, Shayla. All righty, motion passes. And the last one, Tawny, is for the NOFO for positive behavior support funding recommendations.
Perfect. This one will be pretty quick. So positive behavior support is used to develop and employ plans of support for individuals whose disability is accompanied by problem behavior. Positive behavior support focuses on proactive and educational strategies to both expand an individual's behavior repertoire and redesign environments. Proposals for this program area must include the following: functional assessment to identify possible, relevant, and maintaining stimuli in all major environments in which the behavior occurs, person-centered planning, assembly and participation of a team that has agreed to support the individual, direction, observation relevant to confirmation of hypothesis regarding the function of the problem behavior. So year one, we have $279,141 with the total amount requested around $293,000. Year two, a little bit different, $279,922. And the total amount requested is the same, around $293,000. So the first one we have is Neighbor Network of Northern Nevada. Their objectives are to increase screening and assessment of individuals with IDD for dementia statewide, promote self-direction and independence for people living with dementia and their families by ensuring additional community resources are assessed, use data to inform the planning of person/family-centered companion services, personal care, and respite services to people living with dementia and their primary caregivers within a community-based dementia-capable framework, provide statewide in-person and virtually culturally sensitive positive behavior supports to paid and unpaid primary caregivers in specialized training topics such as IDD, behavior symptoms of dementia, and approaches for all stages of dementia. and implement specific strategies throughout the project period, scale, disseminate, and sustain the positive behavior support project. So we're recommending the funding amount for $79,141. And next we have University of Nevada, Reno. This is to provide live in-person / virtual positive behavior support trainings and direct assistance to parents, caregivers, providers in their homes and communities through a series of workshops to offer the pre-recorded workshops for rural partners aimed at supporting families, community members, providers, and professionals who assist individuals with disabilities and/or challenging behaviors. They will also use the funding for training and direct assistance. The recommended funding amount is $200,000. And that's it for positive behavior support. If anybody has any questions or recommendations, let me know, and then I'll turn it over to the chair.
All right, hearing no questions, I will ask that we get a motion.
This is Shayla Holmes. I'll make the motion to approve.
Thank you. And a second?
Hi, this is Ellen. I'll second.
Thank you. All those in favor signify by saying aye.
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 Any opposed? Any abstentions? Perfect. The funding recommendation for positive behavior support passes. All right, we took care of item number 7 already. We'll bring it to item number 8 for possible action. Fund for Healthy Nevada, NOFA on Family Resource Centers funding recommendations. Michelle?
Madam Chair, Stacy,
Yes, ma'am.
can we go back to respite and can I ask for a clarification?
Of course.
Ally, did you second the recommendations on respite?
Oh, yes, I did.
Okay. I believe although not funded, you had applied for respite funds, and I think for full transparency, perhaps we could revote and you could abstain.
Oh, sure.
Okay.
Is that correct, Ally? Am I correct in
don't-
that?
I don't believe so, but I don't believe we applied.
Okay. I believe we have an application from Foster Kinship that we did not fund from Healthy Funds.
If you did, I'll definitely check with our grant writer. So I was unaware, but yes, thank you.
So,
Would it, oh, go
Mr.
ahead, Kelly.
No, please.
Oh, I was gonna, can Tawny go back and look through the applications? We can have Michelle do her presentation and then go back to number 5 if needed.
Quite sure.
Well, I can definitely verify that foster kinship, there was a application under respite.
Okay, well, I'd be happy to abstain and revote. That'd be absolutely fine.
Perfect. We will do that. Thank you, Kelly, for letting us know. So moving back to number 5, were there any further questions on the respite funding recommendations? Hearing none, can I get a motion to approve the funding recommendations as presented?
This is
This is
Ellen. I'll move to approve. Sorry, Fernando.
No problem. Fernando, I'll second.
Wonderful. Thank you for the first and the second. All those in favor signify by saying aye.
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 Any opposed? Any abstentions?
This is Ally. I abstain.
Thank you
This
guys.
is Shayla Holmes. I will also abstain, just to make sure that's noted for the second time.
Perfect. Thank you. Sorry I cut you off there. Awesome. The respite funding recommendation passes. Thank you again, and thank you, Kelly, for bringing that to our attention. Moving on to item number 8, is the NOFO for Family Resource Center funding recommendation. Michelle?
Thank you, Madam Chair. Okay. Hello, so sorry about that. I hit the wrong button. Okay.
No
Can everyone?
worries.
Yeah, okay. Gosh. All right. My fingers go faster than my brain sometimes. All right, let's do, there we go. Okay. This is the FHN Family Resource Center's funding recommendations from the Grants Management Unit for state fiscal years 26 and 27. And again, I'm Michelle McNeely. I'm the social services specialist that manages the grants under this funding. Okay. The agenda, once again, purpose of funding. We'll go over the overview of eligibility, the available funding for state fiscal years 26 and 27, the applicant review, and the funding recommendations, and then finally the conclusion, and then I'll open it up to committee questions. Okay, the purpose of funding. The Family Resource Centers offer referral services and case management to any at-risk individual or family seeking services in the committee. They also offer programs to assist senior citizens, education on parenting and or childcare services, programs teaching skills for employment and self-sufficiency, transportation services, or any other services needed within the communities that the FRC serves. Family Resource Centers can use this funding to create new programs, expand current services, and to collaborate with other agencies, schools, faith-based organizations, and government agencies to assist families in obtaining needed services. Eligibility criteria, any eligible nonprofit or public organization that currently offers services as a state of Nevada Family Resource Center, or any nonprofit or public organization that is eligible to offer services as a Nevada FRC. The overall family-driven approach should follow the program requirements as outlined on page 3 of this notice of funding opportunity as published on the Grants Management Unit website. Okay, available funding. Again, we've gone over this. There was a 12.77% reduction in funding in year 1 and a 12.52% reduction in year 2. So again, this table shows you our estimated dollar amount available, again, was based on historical availability of funds at 1.7 million plus. And then the approved funding after the reduction for state fiscal years 26 and 27. And then we received a high dollar amount requested out of the 21 applications that we received. Again, this indicates that the need is high. And unfortunately, these funds were reduced for the next 2 fiscal years. And then the total dollar amount awarded is also reflected here. This is reflective of the anticipated yearly cost of the FRC data and reporting system management and maintenance, which is approximately $300,000 a year. Again, this is approximate and is paid from this funding. Okay. And then the review and funding. So out of the 21 received applications, we funded 18 to cover all of the service locations. And that is indicated here. Let's see, sorry, I lost my place. 18 Family Resource Centers are recommended for funding based on the ability to carry out the services under this notice of funding, statewide distribution of services, and again, the availability of funding. The population-based calculation factors included total population of each service area, the percentage of population below poverty, and the percentage of children under 18. And those were all factors in these allocations as stated here. So that is what we have for you. This concludes my presentation. I'd like to open it up now for questions from the committee. Okay, hearing none, back to you, Madam Chair.
Thank you, Michelle. Hearing no questions, I will ask for a motion to approve the funding recommendations as presented.
This is Ellen. I'll make a motion to approve.
Thank you. And can I get a second?
This is Elisa Berlin. I'll second.
Thank you. And all those in favor signify by saying aye. Oh, I'm sorry. I forgot. Thank you. Any abstentions?
This is Shayla Holmes. I will be abstaining.
And just for the record, this is Stacy York. I'll be abstaining as well. And then all those in favor signify by saying aye.
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 Any opposed? All right, item number 8 passes. Thank you, Tony and Michelle, for those presentations. Really appreciate how well they were put together. Moving on to item number 9, informational and discussion only. GMAT vacancies in the calendar. Shannon?
Hello, this is Shannon for the record. I wanted to just kind of recap on some of our vacancies. Currently, we do have 5 vacancies and 1 appointment that is set to expire or that will require reapplication. Currently, we are on hold for all recruiting pending SB 78. We should know the conclusion of that here shortly, and hoping to have more information and disperse recruitment for our next meeting, the first one of the fiscal year of 26. I also wanted to, as noted on our agenda, we did put some placeholder dates for upcoming meetings for planning. We did take in consideration BOE and IFC, and the meeting invites will be sent out after this meeting. I don't know if anyone has questions or anything.
Well, thank you, Shannon, and thank you for getting those dates out. It helps as calendars fill up way too quickly. So thank you. All right, moving on to item number 10. This is your second opportunity for public comment. Shannon, do I have to read all that again?
I do not believe so.
Perfect. Any public comment today? All righty, perfect. Well, that takes us to our last agenda item, and it is 1:45 on May 20th, and I call this meeting adjourned. Thank you guys for your time. I greatly appreciate it.
Thank you, Stacy.
Okay, thank you.